All right, Jennifer, thanks so much for doing this. My first question that I have for you is tell the audience a little bit about yourself and how you started in the mental health realm.
Absolutely. It's a little bit of a road, but it was a fun one for me. So I went to UC Davis undergrad. I studied biology, fell in love with it there. And while I was an undergrad there, I actually had quite a bit of experience counseling other undergraduate students. So I got experience helping folks, guiding them, and I really learned that that was something that I wanted to continue in my life, whatever career I ended up choosing. I graduate undergrad in 2008, which was a recession, so there wasn't much going on. So I got an academic scholarship to go to San Francisco State to do forensic psychology. I was like, oh, this will be cool. I could be like, my last name's Flood. I could be Detective Flood, and work on and help people kind of do like more well, yeah, forensic profiling, forensic psychology. It's which is kind of the blend of criminal law and psychology. So I did that through my excuse me, through my graduate program. I had a lot of hands-on experience. Like we had to do various different shadowing opportunities at jails, prisons, and with various law enforcement. A lot of like field experience. Was wonderful. I realized I didn't want to carry a gun. I realized I wanted to help people in a different way. I wanted to do more of the one-on-one counseling and really like sit with people and help folks and not necessarily work with criminals. So pretty much immediately after, I applied to graduate school at University of San Francisco in clinical psychology. I got in, yay. Loved that program. They have a Sacramento campus. Great program, very hands-on. The faculty were great. And then after that, I'll kind of speed through some of this because I have quite a bit of experience in the clinical world. So I was working at UC Davis for a while as a clinician, as a supervisor, as an educator. I also taught there. And then I did some inpatient work. So at a hospital setting, and then I worked at various different outpatient community mental health programs. So where I was either a program director, program supervisor, clinical supervisor. So I did a bunch of different like admin related roles, as well as supervisor roles, building teams, starting programs. Really enjoyed it. However, through that, I started the farther I would like kind of move up or go into the administrative roles, I wasn't working with patients anymore and I missed it. So I started my practice on the side about almost 5 years ago. I was like, I'll just see a handful of patients and then keep doing my like leadership roles. And turns out I fell in love with having my own practice. And a couple folks reached out to me to come work for me. And I was like, I could do this. Let me get my ducks in a row. And so I expanded my practice, and I've been, let's see, I guess I've been up and going for about 4.5 years now. And I have 16 staff, handful of admin, and then a mix of licensed and pre-licensed clinicians. Then we offer telehealth and in person, and the whole, and like my team's so diverse and their experiences, their cultural backgrounds, like the type of folks we serve. So we serve kids, teens, families all the way from like trauma to grief to anxiety. So I have such a wonderful team, and many of them have worked for me in other places. So it's kind of nice to see them kind of grow and develop into the clinicians they are today. So that's been
Mm-hmm.
my journey. It's been all over, as I
Yeah,
think many of ours are.
yeah. So what is it that you currently do in your current role?
Yeah, great question. I think a better question, I'm just kidding, would be what don't I do? But I wear a lot of hats. Sometimes most of what I do is I do have a caseload because I do want to continue to work with clients. A lot of my patients are actually other clinicians, other providers. So school counselors, therapists, psychologists, psychiatrists. But then I also supervise my staff. So the staff that are pre-licensed, I provide them clinical supervision. I also do a lot of how do I say this? Like training and continued growth for my staff. So like provide training to them in various different areas. I bring other trainers in. Like we just had, I had a friend that came in and did a training on sports psychology and mindset. I also spend the rest of my time doing the various other business stuff, right? So admin, managing like marketing, dealing with insurance companies, all the other stuff. So all the other things that keep the business going.
Mm-hmm.
Oh, and then sorry about that. I also do consulting for other clinicians. So when other clinicians are looking to like start or expand their practices, I help them with that too.
Mm-hmm. My next question is, since you just said that you train a lot of clinicians, how do you sort of do that? What goes into that?
A lot. It's such a good question. A lot of what goes into that is actually asking questions. How can I best show up? How can I best support you as my staff member? How do you learn? How do you receive feedback? What are areas you want to grow in? Where do you think your strengths are? What type of population do you want to work with? Like, what type of therapist are you? And how can I provide you tools and support you in getting to there, as well as supporting a lot of what I do is helping folks build confidence a clinician, it's a little scary. It's a little like, can I do this? Like, I have a pretty big impact here. I want to make sure I'm being helpful. And I don't want to do anything that like hurts them or makes their situation more frustrating or hard. So there's a lot of like validation and helping them build confidence and kind of turn into the clinician they aspire to be.
Mm-hmm. So it's kind of like a consultation practice for those clinicians?
Yeah, absolutely. So come in and we'll talk about their various cases, where they're getting stuck, what they think should be included in the treatment plan, what things they're noticing that they're coming up for them, like as the clinician, as well as for the patient, and then their own personal growth, like how they want to continue to grow as a clinician and learn.
Mm-hmm. So, are you guys like, is this the only place that you're doing these kind of things, like helping psychologists with those things, or like where do you sort of take that from? I'm not sure if I'm asking this right, but
Yeah, no, I'm tracking. Yeah, I primarily do offer just the clinical supervision and like that kind of mentorship in my own practice. I think that the other areas where I've been asked to do that is like with the consultation, where I help other clinicians kind of grow and develop their own businesses. And there's so much overlap between those because a lot of that is confidence building. A lot of that is helping them kind of grow into the clinicians and business owners they want to become as well and kind of deal with the barriers that are coming up for them. But yeah, primarily I offer those services like within the practice, or those are the folks that reach out to me for that.
hmm. My next question is, what are your like pillars that you sort of abide by that sort of really help those clinicians, find out what population they want to work with, how they want to incorporate, whatever they want into their practice.
Absolutely. Another great question. And there's kind of two ways I'm going to answer this for you. For one, I have some values that I have within just the practice and the team that we have. One is integrity, like meaning what we say, doing what meaning what we say, doing what we mean. You know what I mean? But like actually just upholding ourselves with integrity and following like our code of ethics and our legal requirements there. Also team, like being part of a team. And what I mean by that is actually supporting each other and building each other up, and being collaborative, being willing to be open and vulnerable with each other and helpful. Like, hey, like, so you're struggling with this case. This is what I've done here. I wonder if this is helpful. How is this, serving you? So really building a team atmosphere with high integrity. And the last piece of that is community, like serving our community. That's a huge part of why I take all the major insurance policies. Is like I think it's really important to serve our community and everyone that reaches out for support. So hiring folks and encouraging folks that work for me to have that kind of community engagement and involvement and wanting to, get folks into services quickly and get them the support that best matches what they need. So that's one of the kind of responses I have in regards to the pillars question. The other piece about helping individual staff that work for me, I think a lot of that is figuring out what drives them. Where do they find fulfillment and joy in their roles? Like, man, some of that is what types of populations do you want to work with? So is it like kids or teens dealing with anxiety, or is it folks managing OCD, or is it trauma and loss and grief. So figuring out really like what the type of population you want to work with, and then helping them determine like what tools they need, what type of training and tools they need to get there. And so they're supporting folks that are within their scope of practice. And scope of practice just generally by definition means like you have the training and experience to serve that population. And I think there's also a component of like personality, once you what you want your life to look like, your quality of life in regards to like what are your family dynamics, meaning like do you have two little kids at home that and you're trying to work with your partner to like raise, so you don't want to work during evening hours and like you don't want to work with little kids because you'd rather work during the day so you're home with your family at night. And you spend a lot of time with little kids, so you want to work with adults in your work, so kind of those pieces play a part too. Does that
Hmm.
does that kind of answer what you're
Yeah,
looking for?
that answers my question. What I was going to ask is how do you guys as sort of a consultation sort of firm or whatever, how do your approach differ from other types of companies or consultation firms that don't really have this model? How are you guys basically unique in
Mhm.
this way?
So I run a group practice, like, a group practice where we have pre-licensed and licensed therapists. So, I would say the standard model for most group practices is pretty similar, right? You got a mix of licensed folks, associates that are pre-licensed, interns that are accruing hours and getting supervision. I think that the things that I kind of hang my hat on is we have a very diverse team, right? I try to hire folks that or be open to hiring folks and bringing people on the team that serve our communities because California is such a diverse state. So folks of all different ages, cultural backgrounds, specializations, types of people. Folks want to work with like the broad spectrum of people. So kids, teens, families, trauma, personality disorders, all the things. So we have a really diverse team that serves the community. The other piece on a more personal note is I really do everything I can, like put all my resources into providing a place that allows folks to have good work-life balance. And what I mean by that is they can take the vacations they want to take whenever they want, take time off, they can completely unplug. They've got support from me and the team to support their caseload when they're out. They get, the full benefits, like healthcare and all that. They can choose, like they have control over their calendar, like when they work, what days a week, what times, what best serves like their family. And then they really have voice and choice over who like the populations they serve, the type of work they do. Additionally, you've probably caught on that I'm really careful about who I bring on the team. Like I'm really big about team atmosphere, so they get to build relationships with each other. Because sometimes working in a group practice or a private practice can be really isolating. So they get exposed to a community and get to build relationships there and grow and learn from each other. All while I try to kind of as we were talking earlier about bringing in like outside trainers and different folks to continue to provide training and education to the team so they can grow and learn as clinicians while working for me. So
Mm-hmm.
hopefully that kind of gives you
Yeah,
some insight to that.
yeah, that answers. My next question is like, what have, people that you've, psychologists that you've trained with, what have they said, when working at your, company, what are some of the common themes that you've heard?
Yeah, great question. And some of them I've touched on, so I apologize about redundancy. Is like this is a great place to be for work-life balance, right? I love that I can still balance my home life or even another job and be able to do the work that I want to do. Like the work with build my skills and build my passion for the type of community I want to serve, the type of patients I want to work with, type of clinician I want to be. There's that flexibility and support to be able to do that, all while kind of still maintaining the capacity to thrive in the other areas of your life. And the work we do is hard. It's wonderful, but it's hard. So being able to work at a place or find a balance in your life where you're taking care of yourself while to allow you to be able to show up for others is so important. So I think like that's probably the through line here is like the quality of life, having support, being able to take care of yourself so you're able to show up for others and find that balance where this job is wonderful and not very draining.
Mm-hmm. Lastly, to wrap this up, what can other companies that are aiming to do the kinds of work that you're doing, what lessons can they learn? What tips can they sort of consider when creating something like this?
Yeah, I think a big one that stands out to me is be intentional about building a team. Try to bring the team together because it can be so isolating the type of work we do. We can spend all day in front of other people, helping other people, but it can be extremely isolating when you're doing that. Because as clinicians, we're not sharing ourselves, we're showing up for other people and being a container and supporting other people. And so if you don't have a team around you to be able to like talk about cases and get support and connect and like empathize and support each other, it can be so hard. It can be really draining and really isolating. So building a team and building and then providing that level of supervision where you're building your staff up and building their confidence and allowing them space to be vulnerable and talk about difficult things and learn as we kind of turn into the clinicians we're striving to be.
Mm-hmm. All right.